system is more than bricks. It has a pulse. It breathes. And like every pulse, it tells a story, not only of survival, but of stress, resilience, and the peril of stillness. Geometrically, a corner is a moment of reckoning, the precise point where one direction ends and another must begin. When a system reaches a corner, it has only two choices: crash into the wall of stagnation or pivot. For decades, Nigeria's health sector hovered at the corner, barely moving, barely breathing. Not for lack of policies, but because too many of them failed to make the transition from concepts to results. At that corner stood health facilities, dilapidated, scarce, and overstretched. Nigerians traveled long distances for basic care. Diagnostic centers were out of reach, equipment obsolete, and manpower stretched thin. This was a corner defined by weak systems and weaker access, where preventive care was minimal, response times slow, and outcomes uncertain. For too many Nigerians, healthcare was not a right enjoyed, but a hope deferred. But corners are not destinations. They are turning points. In healthcare, a curve records that transition. The moment a system stops holding its breath and begins to bend towards survival. And slowly, deliberately, Nigeria's health sector began to turn. From expanded primary healthcare centers to improved diagnostic capacity, from broader health insurance coverage to renewed attention on infrastructure and workforce development, the system is inching away from the stagnant corner. This documentary captures that moment, when a sector long defined by neglect begins to find its footing, when policy meets people, when the corner becomes not a dead end, but a point of transition. The recovery curve is the anatomy of that pivot, the story of how Nigeria's health system stopped holding its breath and began to ascend, finally exhaling with relief. In medicine, a pulse that does not change is not stable. It is failing. The recovery curve did not begin from zero. It began from a deficit. In the southwest, southeast, and south-south, public hospital beds were stretched to capacity. In the north, the distance between a sick child and a working ventilator was measured not in kilometers, but in years of neglect. Medical inflation outpaced household income, turning care into a luxury rather than a right.
President Bola Ahmed Tinubu, in the course of his campaign, came up with a manifesto titled the Renew Hope Agenda. And within that manifesto, health is centrally placed. And the driving motivation for the health agenda of that manifesto is to reflect that the health of all Nigerians is a matter of urgent attention, urgent matter of rights for all Nigerians.
And as physics reminds us, The heavier a system at rest, the harder the turn. Then something shifted. By mid-2024, the curve began to bend upward. For the first time, the National Health Act was treated not as guidance, but as a mandate. The sector-wide approach, SWAP, was born.
The goal of the Health Sector Renewal Investment Initiative is to save lives, reduce physical and financial pain, produce health, and to do it for all Nigerians, to ensure the poorest and most vulnerable in our society, our children, our women, our elderly, get the care that they need. And as the President unveiled his Health Sector Renewal Investment Initiative, it had 4 pillars. One was to improve the governance in the sector, to bring the federal government, state governments, local governments, private sector, civil society, and development partners to orient us towards serving the Nigerian population, to be more transparent, more accountable, and to use data in the decisions we make, to have stronger, effective, efficient regulatory framework for our professionals and also for our pharmaceutical products through NAFDAC and a few other agencies. That's the first pillar. The second pillar is to improve population health outcomes by expanding primary health care, expanding the functionality of the primary health care system, ensuring that frontline health workers, retraining them, and to ensure that the Basic Healthcare Provision Fund reaches the nooks and cranny. All the states of the Federation now receive funds from the Basic Healthcare Provision Fund on a quarterly basis to revamp and to ensure that Nigerians get services.
The strategy was threefold: infrastructure rehabilitation, supply chain stabilization, ensuring medicines reach the shelf, digital accountability, using data as the new currency of trust. And the numbers began to move. At the primary care level, the vital signs were unmistakable. Annual PHC visits rose from 15.1 million in 2024 to a staggering 170.8 million in 2025. 1,965 PHC facilities achieved Level 2 functionality, enabling 24-hour care and safer childbirth for the first time.
If you look at the quarterly numbers were about 13, 15 million in 2023. Now it's about 45, 46 million, depending on which quarter you look at. That's still a significant jump. And what that reflects is an increase in access built on an improvement in the trust for the system. One of the thrusts of the primary healthcare revitalization is the workforce revamping, increasing the number of what we call skilled birth attendants that are working in the health facilities, but also upskilling them so that they are more efficient and they are more up to date in the skills that they have. So I'm sure you are aware that Mr. President, President Bola Ahmed Tinubu, kicked off or mandated us to do a retraining of 120,000 frontline health workers. We are at about 80,000 now, just under 80,000 of them have been trained, and we are continuing to do that in integrated primary healthcare services, which means all of the elements of care that a Nigerian might need: a woman, a child, a man, when you walk into the health facilities. We are continuing to do that. But in addition as well, we are on a drive to recruit health workers and working with states through some sort of arrangement that we have to incentivize the states to actually employ these health workers, additional health workers. 20,000 additional health workers have been employed by states and local governments and deployed to primary healthcare services. As we measure also is to then start to incentivize good quality care across board. In fact, there are incentives tied to rural facilities for the health workers that are there to help them to be retained.
5 new federal tertiary hospitals were established, bringing the national total to 84. The emergency network, SEMSAS, ambulance system became operational in 29 states plus the FCT. This was not a healthier population overnight. It was an invisible population finally being seen. Data became the new pulse of the system, a ledger of trust. By 2025, the indicators began to shift. Mortality falling, the ultimate signal of success. Facility-based maternal deaths dropped from 904 to 460, a nearly 50% reduction. Skilled birth attendance increased to 86.3%. 26,431 obstetric emergencies were resolved through SEMSAs. 34,331 rural mothers and neonates were saved through RESMAT. Over 20,000 women received surgical care under the Semonsi program, while more than 4,000 women were treated under the NHIA-free fistula program. HIV treatment coverage reached 87%, with a 95% virology suppression rate. But recovery is never a smooth arc. As demand surged, human capacity struggled to keep pace. Yet, the Japa syndrome remains the system's greatest hemorrhage. In 2025 alone, 23,000 additional frontline workers were trained. Between 2024 and 2025, a total of 78,146 personnel were trained, reaching 65% of the 120,000 national target. The bleeding has slowed, but it has not stopped.
If you look at the facility, even the structure of the facility before and now, there are changes. Our facility now look like one of the UPTH. We have GRM, that's the grievance redress mechanism to redress any grievances. Prevention, most of the equipment that we don't have, they provide.
And this basic healthcare provision fund are helping the facility because there is beneficiaries that they are coming for their complaints in the primary healthcare. And this basic healthcare provision, they are giving us some money every month so that we can treat these people free. So this will encourage the community people to come to the facility.
The National Emergency Medical Transport System is also active in about 30-something states now, where we have their numbers. They issue vouchers to the women, and they give them transportation to the health facilities where they can receive advanced care. These health facilities, when they get there, because it's an emergency obstetric complication, the services are free. I think it's a journey, like I said. We came from a very, very low point. Unfortunately, before President Tinubu, the primary healthcare system had been underfunded chronically for decades, and a lot of the prior investments had deteriorated over the years. But this president came and said that is not acceptable. He put in resources there. He enabled his team, and we started to move. And all of the progress that you are seeing is as a result of that.
By 2025, the recovery curve finally met the recovery bed. Health insurance coverage increased from 19.2 million Nigerians in 2024 to 21.7 million enrollees in 2025, growing by 13%. BHCPF 2.0 enrolled 2.7 million Nigerians by fourth quarter 2025. Provider incentives rose significantly. capitation increased by 93%, and fee for service by 378%.
The government's intervention is that any woman that has a complication in her pregnancy that goes to a hospital, money should not be the problem. NHIA, under this agenda of this administration, will pay for the services. So far, since this program started in October 2024, almost 40,000 women have benefited from this. And these are women who come with bleeding or they need CS that costs money, etc.
Over 1 trillion naira worth of substandard and falsified medical products were seized and destroyed.
Since I started attending to this facility, I've never paid anything. From my antenatal to the delivery till date, I'm still taking vaccine for my baby. I've never paid anything. The staff are so good to me, especially the midwife.
It's commendable. So far, so good, though this is my first time of coming to this place. It was not easy to locate this particular place, but with their direction and help, I'm finding it easy. So I commend them for their service.
These are not isolated voices. They represent individual experiences gradually aligning with national intent. And beyond these individual stories, the system itself is becoming more responsive, more visible, and more accountable.
In our own case, tripling of the number of facilities in this under this program. So we now have a good percentage, almost 80% of our state facilities will be carried under this program. So that improves the facility functioning and improves the well-being of our people and direct intervention into improving the healthcare of all the people in our state. President Bola Tinubu's program has been made a significant impact in the delivery of primary healthcare, and we are thankful for that.
For us, it's timely and it fits into our model. Of course, both ambulances and then the vehicular ambulances, one of the products that is there at all times is also the mosquito-treated bed nets, because we believe that any encounter with anybody is an opportunity to also do health promotion and also solve the issue of maternal and child beds. So it's already there. Minibus ambulances dispatched across communities that are waterlogged, so that when mothers are in labor within the community, these ambulances will go to their houses and then bring them back to the hospital and also take them back.
As the curve began to take shape, a new institutional layer emerged, one that speaks directly to a long-standing gap within the system. The creation of the Office of the Special Assistant to the President on Women's Health marks a deliberate shift toward a more coordinated and focused approach to women's well-being, beyond maternal care, toward a broader continuum of health access, information, and agency. For decades, one of the most invisible barriers to care has not only been distance or cost, but knowledge. By positioning information as a critical tool of access, this office signals a subtle but important turn in the recovery curve, where empowerment becomes as vital as infrastructure.
There is no sustainability embedded in the programs that are being designed or set up for women's health or adolescent health. So that means that whenever the tenure of the program is done, whenever there is a funding hiccup, everything crumbles. People leave and we're back to square one. So having an office like this sets up a very strong coordination and facilitation mechanism when it comes to women's health, and work is already underway, and things are changing. Women's health is now national development priority, and the president has directed both resources and institutional backing to make sure that women's health becomes priority.
The first ever mini demographic and health survey flagged off in 2025 to the historic rollout of malaria vaccines in Bayelsa and Kebbi states. Nigeria's healthcare system is marking a quiet but significant transition from policy design to measurable impact on the ground. At the community level, innovation is closing long-standing gaps. The Save Mama app is digitizing rural emergency transport, ensuring that for many mothers, distance is no longer the difference between life and loss.
Renew Her standing for Health, Equity and Reform, which pretty much encompasses what we're trying to achieve when it comes to women's health in the country. It has three big pillars. First is the Digital Media and Advocacy Hub, and that came from the understanding that more than half of the world's population on social media. When you look at Nigeria, a lot of people, regardless of even their socioeconomic status, most people, even in the rural villages, maybe not the last mile, but you still get to the rural villages where people have access to data. And you find that when a woman has a question about her health, where does she go? Social media, Google, these are the things coming up online. And so if you really want to increase the health literacy of our population, if you want to encourage health-seeking behaviors, if you want to debunk myths and make sure that people are well informed and are able to take charge of their health, you have to meet them where they are. So the Digital Media and Advocacy Hub provides an anchor for that. But also we know that the communities, the last mile communities, are also of priority. So we are making sure that information is disseminated using local languages, using radios, and using any medium that citizens will get their information.
At the facility level, critical hospital units are being solarized, guaranteeing uninterrupted power, steady oxygen supply, and continuity of care where it once faltered. They are signals of a system beginning to respond. Yes, the system may be improving, but beyond infrastructure, beyond policy, beyond numbers, there is a more delicate measure of recovery: public perception. Because progress on paper is one thing, but the real question is, can the people feel it? To answer this, NTA News conducted a nationwide online survey in February 2026, inviting Nigerians to assess the change within the healthcare system. What emerges is not just data, but a reflection of lived experience, of access, of trust, and of expectation. Here is what Nigerians are saying. These survey results serve as a mirror, reflecting the ministry's data back through the eyes of the people. The responses suggest a sector finally finding its rhythm, with public perception trending toward a cautious yet visible alignment with the official numbers. However, the data reveals a stark regional divide. While some regions are racing ahead, others are still navigating the shadow of the corner. The verdict is clear. Nigeria's health sector is undeniably turning the corner. But the speed of that turn is not yet felt equally by all.
We can't talk about the health system without talking about the economics of the country. When this present government came, it embarked upon, from the very first day, very tough economic reforms. We are hoping that in the future we will see the gains. But at the moment, those reforms are telling heavily on the health sector. In 1 year, you have over 6,000 doctors leaving the country. Who are the people that will ensure the health care of the people? Yes, we have the basic healthcare provision fund, but that is like a drop in the ocean compared to what is needed.
Since the coordinating Honorable Minister of Health has stepped in, you can feel some change. You can actually see some change. Take, for example, crashing maternal mortality. We find that this administration has been very, very deliberate about getting that done. Talking about cascading policies into implementation. This administration has been very deliberate about that. We have what you call now, the compact. And I'm not alluding to the fact that we still don't have challenges in the health sector. More than anything else, government should ensure the funding of the healthcare sector. I think another important thing is ensuring equity across board. Oftentimes, you have, if you live in Lagos, for example, there's and you have complications that needs specialized attention is there. But if you go to other regions of the country, it's not available. So there must be, an effort to ensure equity, and that's what the universal health coverage is speaking to.
The challenge now is to ensure that the recovery curve flattens the barriers of geography, to ensure that no Nigerian, regardless of their state or status, is left behind. Indeed, it is not yet a clean bill of health, but it looks like a doctor's report for a patient showing remarkable recovery. But recovery is not a destination, it is a discipline. The corner was the pivot of policy, but the curve is the trajectory of the people. No doubt, the system is breathing again, heavily, imperfectly, but alive. It is evidence that indeed the health sector is finally turning the corner. But it is only by closing these gaps that the country can truly construct a digitally anchored, transparent health system.